Transportation webcast. My name is Stephanie Lewis, and I will be moderating today's webinar. And I would like to take this opportunity to introduce Dr. Jeremy Matson. Jeremy has been working for the Small Urban and Rural Transit Center program of the Upper Greater Plains Transportation Institute at North Dakota State University since 2007. He conducts research on issues important to rural and small urban transit in industry. His research areas have included rural transit needs assessment, ridership modeling, cost-benefit analysis, mobility management, rural inner-city bus demand, travel behavior, mobility, and transportation needs of older adults and people with disabilities. Dr. Matson is an assistant professor within North Dakota State University's College of Business, where he teaches a course on public transit. He received his PhD in transportation and logistics from North Dakota State University, and he also holds a master's degree in agricultural economics. With that being said, I'm going to welcome Jeremy. Take it away.
All right, thank you, Stephanie.
You're welcome.
Okay, so this project was a three-phase collaboration. We collaborated with the Texas A&M Transportation Institute, or TTI, and the general goal of the entire project was to explore transit's contribution to livability, specifically in rural communities, and then also with the national survey, we expanded it to urban communities as well. So the first phase of the project was a lit review and a pilot case study, and that was conducted by TTI. And I should mention, TTI they were the general lead for the entire project, and we helped them at Small Urban Rural Transit Center at NDSU. We helped them on doing case studies and designing surveys and doing some of the data analysis. So the first phase, they did a pilot case study in a community in Texas. And then based on the method that they developed in that pilot case study, we did a series of case studies in phase 2. We did a couple case studies in North Dakota. TTI did some other case studies across the country. The general framework of the case studies involved a survey of the general public or the residents in the community, a survey of the transit riders, and then interviews or surveys of stakeholders within the community, such as human service agencies or transportation providers or city officials or employers or schools, etc. And then based on the results from that and the surveys that we did and the case studies, we kind of revised that and expanded on it and created this national survey, which is mostly what I'm going to talk about today. We did another webinar for Cutter a couple of years ago where we discussed the results from the case studies. So today I'll just kind of give a little bit of a summary of what we did in those case studies and also talk about some additional analysis of the case study data that I did after that last webinar from a couple of years ago. And then I'll talk about the national survey that we did. This is the project team. Jonathan Brooks with TTI. He's not with TTI anymore, but he was with them at the time. And he was the lead for the entire project. He was really kind of the driver for the entire project. And then a number of other people at TTI and Texas A&M assisted him in doing the case studies and designing the surveys. And at UGPTI or NDSU, Ranjit Ganavarthi and myself were involved in the case studies and data analysis, and Jill Hogan, Dale Peterson were also involved. So first, just a summary of the case studies we did. These were the 6 case studies. They were in cities with populations of a couple thousand up to 20, 25,000. So we did, like I mentioned, the general public surveys, the rider surveys, and the stakeholder interviews. And I'll talk a little bit about the findings from the general public surveys, because I think that was the most interesting. In these surveys, we asked them a series of questions. First, we asked them what factors that they think are important for livability in any particular community, What do they think is important for livability or community quality of life? And then we ask them specifically to think about the community that they live in and what factors are contributing to livability within their community. And so we kind of looked at the results from both of those questions and kind of compared them to see what do they think is important, what's the quality within their communities, and how can we improve overall livability. We asked them about how satisfied they are with the quality of life within their community. Ask them questions specifically about transit. Do they think transit is important? Why do they think it's important? And also, do they support funding transit in their community from including different types of funding sources, federal, state, or local? We ask them if they use transit, are they aware of transit, and also are there situations in which they might use transit? Um, in there, we found that mostly they 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 supported transit and they thought they might use transit if when they get older if they can't drive. So I'll show the results for this is for Bath, Maine. So what this shows is the the wider light green bars. These indicate the percentage of the respondents who thought that um, one of the livability factors was important. So for each of these, we listed a number of livability factors, which you see on the left side. We asked them to identify which six they think are the most important. So the figure shows the percentage who thought that each of these are among the most important. So you see low crime has the highest. So about 2/3 of the respondents thought that low crime is one of the most important factors for livability for any community. And then next you see affordable housing and walkability and quality public schools. These are what they thought was most important. And then we asked them, what are the factors that are contributing to livability in your community? And so the narrower, darker bars show the percentage of respondents who said that factor is contributing to livability within their community. So in Bath, Maine, the respondents thought that low crime, that walkability, that parks and amenities, those were particularly contributing to the livability within their community in a positive way. So it's interesting then to compare the two and look at, for some factors like say affordable housing, more than 60% said that it's an important factor, but just a little bit over 50% said that it's contributing to livability within their community. So that suggests that there's some gap there that they could improve livability by improving the access to affordable housing. And you can look at for other ones where like quality public schools or available jobs, there's a large gap there where they think it's important, but it's not really contributing to livability within their community. And other ones like walkability, you see that they were pretty satisfied with the walkability within their community. You can go down the list a little ways to find public transit. Public transit is not among the most important factors for livability, but a lot of the respondents still think it's important, and results suggest here that there could be there's some gap there where there's room for improving it to improve the livability. And so we made graphs like this for each of the communities, and you can just compare them and see how between the different communities, respondents may have different opinions on what they think is important, and certainly so there's different opinions on how those factors are contributing to livability within their communities. You do see some similarities, though. You see like low crime and affordable housing show up on the top for I think almost all of them. So all of the residents in these communities think that those are really important. Um, Dickinson was kind of interesting because Dickinson had been experiencing some pretty significant population growth because of the oil boom in western North Dakota, and that's died off the last few years. But these case studies were done about 4 years ago, So at the time, there was a lot of concern about the increased population growth and the effects that that might have on crime, on affordable housing and cost of living. And so you can really see that reflected in these results here, where they rate those factors as being really important, but there was a very small percentage of respondents who said that, say, affordable housing was contributing to livability within their community or cost of living. So you see really a big gap there where you can improve livability by improving access to affordable housing and reducing the cost of living. So you see that public transit tends to be a little bit further down the list, where not as many said that it's among the most important, but there's still a number who say it's important. And then when you dig into the data a little bit further, you can see how the importance of public transit with regard to livability. This was another way. So this was some additional analysis that I've done after the last webinar that we conducted. Uh, this figure is another way of looking at the data. So, and this is specific for the two North Dakota communities of Dickinson and Valley City. So this shows the percentage of respondents who said that each of these factors is important to livability, but it's not a top contributor to livability within their community. So we asked them to rate the importance of these factors from not important to very important. And then we asked them, is it one of the top contributors in the community? So this, for example, shows for affordable housing, 56% of the respondents said that affordable housing is important or very important. And they also said that it's not a top contributor to livability within their community. So this results would seem to indicate that there's a desire for improvement in affordable housing as well as cost of living, quality of healthcare. A lot of people think these are important and it's not contributing to livability in their community. And then you look down the list, public transit is towards the bottom where 19% said that it's important, but it's not the top contributor to livability in their community. And then climate is on the bottom, which this is North Dakota we're talking about, so maybe that might surprise you. But either people don't care about it as much, or they're fine with the climate. But then when you analyze this data a little further, you can see that the public transit and climate as well are actually kind of important. So one other question that we asked is um, how satisfied they are with the quality of life in their community. So the question was, rate on a 1 to 5 scale from completely completely agree or disagree that they're satisfied with the quality of life. So this shows those who either agree or completely or strongly agree that they're satisfied with the quality of life in their community. And there's some variations you see between the different communities, and within each community there's also some variation between those who agree and don't agree. So I wanted to look at this data and try to understand what factors are contributing to their responses. Why are some people satisfied with the quality of life, and why are some people not satisfied? So I did some analysis where I looked at this data, at the people who think that it's important, but it's not contributing to quality of life. And does that explain in any way their response to how satisfied they are with the quality of life? And so what I found was that people who desired better public transit, better climate, better public schools, or better cost of living than what is currently available in their community, they were less satisfied with the quality of life in their community. So then going back, looking at this 19% of people who desire better public transit, they were less satisfied with the quality of life in their community. They gave lower scores for the community quality of life. And the same thing for this 15% who desired better climate. Their scores for the community quality of life was lower. Whereas on the other hand, although 56% desired better affordable housing, their scores on the quality of life were not any different than the other 44%. So it shows that even though a smaller percentage of people are concerned about the public transit or the climate or the quality of public schools, for them, it really had a negative impact on their perceived quality of life. So it might influence a smaller number of people, but for them, it's really important. So some general observations from the case studies. The method that we developed that identified the factors that residents in these small cities believe contributes to livability. And there's some differences between the communities, but there's also a lot of similarities. It identified potential improvements to improve individual community livability. And the residents that we surveyed, specifically regarding transit, so we asked them some questions specific about transit, and they believed it was important for transit to be available within their community. Even though most of them didn't use it, they thought it was available. And when we asked, why do you think it's available? And specifically for seniors, for people with disabilities, and for people who can't drive. Which is great, but also we need to be able to fund transit in our communities. So we asked them about their support for funding transit from federal, state, local sources, and they generally supported funding transit as well. More so with federal and state sources, but also the majority tended to support funding transit with local sources as well. And many of them said they would be likely to use transit if at some point they would no longer be able to drive. And the transit riders that we surveyed, they agreed that the service is important to their quality of life. Many of them have limited or no other travel options available to them, and they were generally satisfied with the services that were being provided. So then the next phase of the project was to do a National Community Livability Survey. So we developed this survey based on the surveys that we had did in the case studies. We kind of expanded them a bit and revised them. And the surveys were conducted a couple years ago, and it was sent to both rural and urban populations across the country. We received close to 1,000 usable responses. The topics on the survey include, similar to the previous surveys I talked about, the general community livability. We wanted to understand what they think was important for livability, and we expanded that list a bit in the national survey and also included some more specific transportation factors. We asked them to rate the quality of those factors within their local community. We asked some characteristics about their community. We had some more specific questions about transportation factors, like I mentioned. We asked about public transit, about do they use it, are they aware of it, is it available to the community, are they interested in it, under what scenarios would they be likely to use public transit. We had questions specific about walkability, also again, their support for funding transit. And we collected demographic characteristics data and also some follow-up questions specifically for transit riders about their use of transit, why do they use it, what do they use it for. We also stratified the survey by the survey sample by geography. So in the top right map of the U.S., you see that these counties are categorized based on the a nine scale of 9 different categories, ranging from completely rural to large metro areas. This is based on the rural-urban continuum code, which is developed by the Economic Research Service. It ranks all of the counties in the state on this 1 to 9 scale. So the dark blue is the largest metro areas, to the yellow is the most rural areas. And even though a large majority of the population in the country lives in those blue metro areas, we wanted, we stratified the sample by each of these categories so that we had a similar number of responses from each of these 9 categories. So we sent out the same amount of surveys within each of those 9 categories, so that the rural areas then were oversampled, so that we could get a large enough number of responses from those rural areas, so that we can make comparisons between the rural and urban areas. We also stratified the sample by regions of the country or the census divisions. So you see the map in the bottom left. We sent out an equal number of surveys to each of those divisions. And so we ended up with a fairly similar number of responses between divisions, survey census divisions, and between the different uh, rural and urban areas. And then for survey administration, and this is something that TTI did themselves, they take all the credit for this. I was not involved in the administration of the survey, but they first sent out a postcard with a web address so that the respondents could take the survey online, and it was also available in, I think, 5 different languages. Then they also sent out email invitations for people who they were able to obtain email addresses for. And then they sent out a physical mailer that it also included the link to the online survey, but then it also included the survey in a paper form, which they can mail back to us. And again, that was also available in at least a couple different languages. So I'll go through the results of that national survey. So the first question was for them to identify the importance of different livability factors, or what they think are important factors affecting community livability in any community. And so this is a list of community livability factors we included in the survey. They rated them on a 1 to 5 scale, from uh, not important to very important. And in the survey, in the figures here, I showed the differences between the residents in the metro areas and in the non-metro areas. So in each of these figures, the non-metro residents will be shown in the green bars and the metro residents in the yellow bars. And in this case, the results are actually kind of similar between the metro and non-metro residents. They both said that quality healthcare and available jobs, quality public schools, low crime, these were the most important factors. If when you go and then um, affordable transportation. So the list of factors here is a little bit different than what we had in the previous case study surveys. We had affordable transportation as one, and that's down the list a little bit ways, but it's still fairly important. And you do see some differences between the metro and non-metro residents, where the metro residents did value affordable transportation, parks and recreation, cultural institutions a little bit higher than the non-metro residents. And then we also included some more specific transportation factors, the importance of these transportation factors to livability, including conditions of roads, congestion, walkability or accessibility, public transit, and bikeability. And so you see both metro and non-metro residents says that having roads in good condition was the most important among these factors, followed by traffic congestion, walkability, public transit, and bikeability was last. So, but public transit is still important, and you do see some differences between the metro and non-metro, where the metro residents tend to place a little bit higher value on having the public transit services. So then we asked them to rate the quality of each of those factors in the community in which they're living in. And again, the green is supposed to be the non-metro residents, and the yellow is the metro residents. So they tended to rate the cleanliness of the environment as being of the highest quality, followed by traffic safety, crime. On the very bottom of the list is where you see affordable transportation. So, and on this list, it was rated from 1 was very poor, 5 was very good, 3 was acceptable, 2 was poor. So affordable transportation rates somewhere between poor and acceptable. And you see it's also lower for the non-metro areas. And this figure shows some more differences between the metro and non-metro areas. And in general, the non-metro residents tended to give lower ratings for a number of these factors, such as affordable transportation, shopping, available jobs, cultural institutions, quality health care, parks and recreation facilities. They were less satisfied with the quality of those amenities in their communities, although they did give higher ratings for, say, the cleanliness of the environment, the traffic safety, crime, sense of community. And then specifically for transport, the quality of the transportation factors, uh, the congestion was the metro residents rated that as being of highest quality, more so than the metro residents, which you would expect. And then on the very bottom is the public transit services, again, rating between poor and acceptable, and especially low for the non-metro residents. So it suggests there that they're rating the quality of the public transit services low, so there's some need for improvement, and especially in those non-metro areas. So then it's interesting to compare the responses to those two questions about what they think is important and then the quality within their community. So this figure shows that those gaps, and this is specific for the non-metro residents. So for example, for the available jobs, the yellow is the importance to livability. So this is how they rated the importance. So available jobs is very important. But within their community, they rated the quality of available jobs fairly low. And you see the same thing for affordable housing, quality healthcare, affordable transportation. These were areas where you see the largest gaps between what they think is important and then the quality of those factors within their community. So if you want to improve livability, you would want to focus on these factors. And the very bottom of the list is the weather. So there's one case where they're happy with the quality, which is good because there's not a lot we can do about that. So that's for the non-metro residents, and then you can look at the same thing for the metro residents where those gaps are, and the largest gaps are for available jobs, affordable housing, low crime. Again, affordable transportation again comes in the top four, so it seems to indicate that improving affordable transportation would have a positive impact on community livability. And if you look specifically at those transportation factors in the non-metro areas, uh, conditions of roads is the thing that they think is the most important, and they're find that the quality is generally acceptable, but still some room for improvement. Public transit services is where there's a gap where they rate the quality of public transit services fairly low, and they do think it's important, if not as important as some other factors. And then for metro areas, the big gaps are for road conditions, and then again, public transit services, followed by congestion and walkability. Tend to be, on average, less concerned about the bikeability or more satisfied with the quality of the bikeability. We also asked them how easy do they think it is to travel to places that they need to go within their community using the options that are currently available to them. So we asked them on a scale from strongly disagree to strongly agree on whether they agree that it's easy to travel in their community. So most of the residents, most of the respondents tended to agree that it's easy to travel to where they need to go. You do see some differences between the metro and non-metro residents, particularly if you look at those who disagree. About twice as many of the non-metro residents disagreed that it's easy to travel as compared to the metro residents. We asked them about the community, the quality of life in their community, and how satisfied they are with the quality of life in their community on a scale from very satisfied to very dissatisfied. And again, it was mostly positive results where most of the respondents were either satisfied or very satisfied. And you do see a similar distribution between the non-metro and metro residents. Although, again, there is a higher percentage of the non-metro residents who were very dissatisfied or dissatisfied. And then lastly, we asked just generally how satisfied they are with life, with their general life satisfaction, kind of a measure of subjective well-being or quality of life. And this is a question that's also been used on other in other surveys. It's a 0 to 10 scale and how satisfied they are with life. And you see a kind of a similar distribution again between the metro and the non-metro residents. I'm not sure why metro residents are more likely to give a 7 than none. I don't know why there's a gap there or some of these differences, but the distribution is kind of similar. So I wanted to look at, to kind of analyze these data to determine, why do some people think it's easy to travel and other people don't? Does the quality of public transit contribute to that? Do other transportation factors contribute to that? Is it all explained by individual characteristics? And then how does that ability to travel within their community affect how they view the quality of life in their community? Are those people who think it's easy to travel? Do they think that the quality of life in their community is better? And then I wanted to see these people who give a higher, who are more satisfied with the quality of life in their community. Are they more satisfied overall? Is their life satisfaction higher? Is their overall subjective well-being greater because of the community characteristics? So I developed some models to analyze those relationships, which I'll talk about in just a bit. I'll just mention that we also, it was like an 8-page survey that we sent to them. So there was a number of questions in there. And so there's more data that we collected and questions that I'm not really going to get into in this presentation, but it's in the report if you want to look more closely. So, but we did ask about, in the general public survey, about their support for transit. And I'll show a few slides about that. And we asked some travel behavior questions. Do they use transit? Are there situations in which they might use transit? We asked about, and we asked about, are they able to access amenities within their community by using transit? Or are they able to access them by walking? Are they able to walk or use transit to get to a grocery store or to their work or school or parks or other amenities? Ask them some questions about the type of neighborhood that they live in or characteristics of the street. Is it a more urban neighborhood or more suburban or rural? So questions about technology and transportation, which are kind of not really related to the livability, but some additional kind of questions that we added on, which are related to, say, car sharing or autonomous vehicles or other types of mobility options. Regarding the support for transit in their community, most of the respondents tend to agree or strongly disagree that it's important for public transit to be available to the residents within their community. See a little bit of a difference between the metro and non-metro residents, where the metro residents were more likely to strongly agree or less likely to strongly disagree, but still you see a majority of the non-metro residents who agree as well. And again, that's great, but are we able to fund those services? And do we want to increase the services to be able to meet those needs? So one question we asked was, given the understanding that to increase transit services, it's going to require additional public funding, do you support more public transit or just the same amount of public transit, or would you prefer less public transit? Very few of the respondents said less. There was kind of a split between those who said, let's keep what we have versus let's add more public transit. In the metro areas, there was a little bit more support for increasing public transit. In the non-metro areas, it's more of a split between the same amount versus more public transit. I'm going to skip over the technology and transportation because I want to get to the data analysis that I did. So I developed three models to estimate the impacts of those transportation factors, such as the quality of public transit, the congestion, the road conditions, the traffic safety, bikeability. How do those impact ease of travel within the community? And then how does ease of travel and all of those other livability factors that we identified in the survey, how do those impact community quality of life? And then how does community quality of life impact overall life satisfaction? So I developed the three regression models, and I'll just kind of give a summary of the results from that. So first, this table illustrates the livability dimensions and indicators. So it just classifies those different livability factors that we included in the survey into four different dimensions. So the first is the social dimension. So, and the livability indicator for this is the sense of community. The physical dimension, this includes the parks and recreation facilities, the cleanliness of the environment, the characteristics of the street, walkability. I also added weather into this dimension. The functional dimension is basically how well does the community function. It includes factors such as ease of travel, availability of jobs, the quality of the healthcare, the public schools, the cultural institutions, affordable housing, overall cost of living, and the shopping and entertainment options. And then the last dimension is safety, and this for this one I included one variable, which is the crime rate. And there may be some other ways that you could categorize these livability indicators. Like you could have traffic safety within this safety dimension, or walkability might be in the functional dimension. So there might be other ways to categorize these, but this is it's a general um, categorization that I used. So for the first model, I looked at how respondents answered that question about how easy it is to travel within their community. And then I estimated that as a function of how they rated the quality of those different transportation factors, such as the quality of transit, the quality of the roads, the congestion level, the traffic safety. And I found that all of those factors were important. That the people who rated transit quality as being better, they thought it was easier to travel. People who thought that the quality of roads were better, they thought that it was easier to travel. Congestion was important. And I did a couple of models. I did one just for the metro areas and one for the non-metro areas and compared the results. And in general, they tended to be similar, but congestion, as you might expect, it was important for the metro areas, but not the non-metro areas. And then individual factors were also pretty important, like whether or not someone has a driver's license. That really significantly impacted how easy they think it is to travel within their community. And that also illustrates the importance of having public transit so that they have other options available to them. And then again, the number of vehicles that they have in the household, that was pretty significantly associated with how easy they think it is to travel within their community. And then so I looked at that ease of travel and all those other livability indicators and how does that affect how they rate the quality of life in their community. And so I did find that people who rated ease of travel as being higher or walkability as being better, they gave higher ratings for the quality of life in their community. And there were other livability factors that were important. Sense of community was actually really important. The type of street that they lived on was important. So I found that people in the more urban environments tended to give a lower quality of life than in the more rural types of environments. Quality healthcare was really important. Quality public schools was also really important for community quality of life as well as cultural institutions. And then some factors were significant for the metro areas, but not for the non-metro areas, such as cleanliness, environment, weather, jobs, shopping and entertainment options, and crime. And then lastly, I wanted to look at overall life satisfaction. So for people who rated the quality of life in their community as being better, did they also rate their overall life satisfaction as better? So does community livability influence overall life satisfaction or quality of life? And I found that it did, that people who rated the community quality of life as being better rated their life satisfaction as being better. And I also controlled for a number of individual characteristics which were important, like the health status of the individual. I asked in the survey, I asked them to rate their health status as either being good, fair, or poor. And so the people who rated lower health status definitely rated their life satisfaction as being lower. And employment status was also important. Uh, Income was not important, but employment status was. So people who were unemployed had a lower life satisfaction. Age had some effect, and it wasn't a linear effect, but it was that people who were in, I think, the 50s or 60s and that age range tend to have a higher life satisfaction, and it was lower for the um, younger age groups, and then decreased for the older age groups, and that's kind of similar to what some other research has found. And then living arrangement. This is as people who are living alone gave lower life satisfaction responses. So some conclusions from this is that uh, so respondents who gave higher ratings for transit quality, for quality of roads, for low congestion and traffic safety, they all perceived travel to be easier within their community. And that was important for determining community livability. So people who rated ease of travel higher, they rated community quality of life higher. And walkability was also important for community life, and there were a number quality of life, and there were many other livability indicators that I talked about, like sense of community and quality public schools, and others who are important for uh, community quality of life. And then those who rated their community quality of life as being better were significantly more likely to rate their overall life satisfaction as being higher after controlling for those individual characteristics. So ultimately, this results show that there's a positive relationship between transportation, between transit, um, all those other transportation factors, and ultimately quality of life. So we have published a couple of reports. The first one was specific for those two case studies that we did in North Dakota. That was published a couple years ago. Then we also have a report published last December that discusses the national survey, shows the results from the survey and some of the analysis that I discussed. And these are both can be found on our website, and one of them is posted on the last one is posted among the links. And TTI again, I think they have some reports available on the case studies that they did as well. So I guess that's what I wanted to cover. Is my email address and the web address for CERTSI. So I guess at this point I could answer any questions.
Thank you so much, Jeremy. And again, thank you so much for referencing that webinar that we did back in 2016. I pulled it up and I added it to the link section of Adobe Connect in the upper right-hand corner. If you're not seeing it, just scroll on down. It's called, it's that Exploring Transit's contribution, sorry, to livability. So that link is there if you want to look at that report or look at the webinar that was completed in 2016. The link is also there. It does look like we have a few questions, but you're interested in asking a question. The Q&A box is located in the bottom right-hand corner of your screen. Simply type in any questions and or comments that you have, and then Jeremy will sort of get started. I know that you completed sort of 3 research reports in this area. Are you doing any further research in this area?
Yeah, actually, we are doing some additional case studies now in tribal communities. So that's something like in the previous case studies, these were all small communities, but none of them were in tribal communities. The national survey doesn't really tell us anything about tribal communities. So we're doing a tribal study now that we'll be doing case. We're looking at potentially 3 case studies on some um, tribal reservations, and we'll be doing some uh, surveying or focus groups in these communities and surveying riders and interviewing stakeholders as well. And it'll be it's interesting to look at the differences between those communities and comparing them to the other rural case studies and the national results to see what they think is important or how they rate the quality of those factors within their communities and the importance of transit in those communities, which can be very, very rural in some areas. Um, and then we're also one of our grad students is doing some additional analysis of the data that we collected in the national survey, and I'm um, not quite sure what's going to result from that, but there'll be some additional data analysis that we're looking at there.
Perfect. You also mentioned that the survey included questions on technology and transportation. Could you elaborate on that and what that included?
Yeah, I kind of skipped over that because I actually forgot that I included it in there, and then I wanted to get to the um, data analysis that I did. But if, I guess I could go back to that slide. Oh, oh, I think it's this one. Um, some questions about so one question was with the understanding that in the future, um, because of say car share programs or other types of mobility programs, that you may not need to own a vehicle yourself. So we asked them, um, do you plan in the future to not own a vehicle, or do you think you're always going to own a vehicle? And you can see in this top table that most respondents thought that they're always going to own a vehicle, like especially within the next 10, 20 years. So, and a little bit of a difference between the metro and non-metro residents, but not really. Most people think that they're not planning to give up their vehicle. And another question that I don't show on here is we asked them if you were forced to either give up your vehicle or your smartphone, which would you give up? Most people said that they would give up their smartphone. Um, a little bit of a difference again between the metro and non-metro areas, where I think it was uh, 25% of the metro residents would give up their vehicle, compared to about half of that in the non-metro areas. But still, most people plan to continue relying on their car. And then the last one was about autonomous vehicles and how comfortable they are with the idea of an autonomous vehicle picking them up and dropping them off. And people seem to be uncomfortable in general. I, me personally, I'm uncomfortable with a human picking me up and dropping me off. And I don't, but in general, people aren't quite comfortable with the idea of autonomous vehicles quite yet. So these were kind of unrelated questions to the livability aspect. We just wanted to look in case we're looking at maybe some future research or just to collect some data right now that in general it looks like people that are not quite comfortable with the idea yet of giving up their vehicles or letting an autonomous vehicle drive them around.
The most interesting part of that was that you said that most people would choose to give up their smartphone over their personal vehicle versus
Yeah,
the fact that most areas have TNCs.
right.
That's sort of interesting to hear.
Yeah. Yeah, and in the larger urban areas, there were more people who would give up their smartphone, but still, most people seem to want to hang on to their car.
Okay. And the last question that comes in, it says, were any of the results unexpected, or are they about what you thought they would be?
In general, they're about what I thought they would be. When you look at the factors that they think are important. Um, they didn't rate public transit as being one of the most important factors. And being a transit researcher myself, I'm thinking, oh, people are going to think that transit's important, but transit doesn't affect everybody the way that, say, affordable housing or cost of living or public schools or crime. Or those things affect a larger segment of the population. So you expect that they're going to think that they're important. But you do see that people are saying that public transit is at least somewhat important. And there are some differences between the metro and non-metro residents regarding their responses, which you would expect. I might have expected to see actually a little bit more of a difference between the metro and non-metro residents regarding some of the questions. Although if you slice the data up a little bit further and compared the most rural areas to the most urban areas, you might start to see a little bit more significant differences. But I guess the results are what I expected. And when you really analyze the data, you do see that public transit is important for those people who rely on public transit. It does really have a impact on their quality of life, which I think you can see in these results. So I guess it's about what I expected to see.
Okay. It doesn't look like we have any additional questions, so in case any do come in, we do have about 5 minutes. But I will open up the evaluation for you. If for whatever reason it doesn't open up on your screen, there is an evaluation in the link section. It's called evaluation.9 9.12.19 with today's date. That will just take a few moments to complete the evaluation. And then Jeremy, I would just like to say thank you so much for taking the time out of your schedule to present with today's webinar. Like I mentioned earlier, oops, the date is wrong on that slide. It is on the 26th. We are going to have one of Jeremy's colleagues speak on Ranjit Gadavarthi on opportunities for state DOTs and others to encourage shared use mobility practices in rural areas. Again, thank you so much, everybody, and have a great rest of your day.